And I want to welcome the next panel up because it's really from insights from retail, insights from patients, which the industry can actually drive decision making. And this is a new industry. We've heard it a million times today even, that the information that we have, how does it impact the business? How do we change business, iterate, provide things people want? And so to dive deep on this conversation, Mare Jones from Rainmaker Agency will be moderating the panel. She's also my neighbor, we learned the other day. I saw her this morning when I was on my way here walking her dog. So the title of the panel is Driving Decision Making Through Patient and Consumer Insights. Mare Jones will be moderating. Sean Copeland from Lift & Co. Their actual booth is over there as well, but everybody knows Lift & Co. Michelle Arbus from Strain Print, their booth is next to Strain Print, and Alex Gregory from the Ontario Cannabis Store, and they'll all be talking about how data that they can provide is impacting decision making on the corporate level. Thanks, guys.
Thanks for the whoop. Appreciate it. Hi, everyone. My name's Mare Jones, and I'm the Managing Director of Rainmaker. We're a PR agency. My primary medium is words. So I was a little confused why I was asked to moderate a panel about numbers, because I don't really like math, except that data actually informs the majority of the stories that we tell. And I think that with these three great panelists, and they have very separate experiences from very different sectors that they serve, we'll really be able to explore how data actually drives consumer decision making. So can we maybe start with everyone introducing themselves? We'll start with Michelle.
Michelle Arbus, and I'm the VP of Research at Strain Print.
I'm Sean Copeland, and I'm the Vice President of Data at Lift & Co. And I've been in consumer insights for about 10 years or so now.
Good afternoon. I'm Alexander Gregory, Director of Data Science and Business Analytics at the Ontario Cannabis Store. And I'd just like to say thank you to Jay Rosenthal and Business of Cannabis for inviting us to the event. And it's a wonderful opportunity, so thank you again.
So one thing that I learned from, One thing that I learned from my daughter going to Girls Rock Camp Toronto is you hold the mic like this, guys, so no one will hear you. So there you go. So we got Michelle Arbus, Sean Copeland, and Alexander Gregory. So you're numbers people. Do you prefer to be called geeks or nerds?
I'm fine with nerd. Yeah.
You're good with nerd?
So I think it's geek is the more appropriate term now.
You know, to each your own. Michelle?
Nerd.
Nerd, definitely. See, we got some diversity here. And I was wondering, without showing too much leg, like maybe a little ankle, a little calf, I was wondering how you build your data sets. You come from different parts of the business. You have different sets of data and different clients that you serve, either internal or externally. I'd love to just hear a little bit about how you do it and who your primary clients would be. And maybe we'll start with Sean.
Yeah, perfect. So I was lucky enough when I joined Lift & Co. They'd been spending years building out these content platforms to really engage and build trust with consumers. And so when I joined, I said, well, this looks like a really good data set we could use. What we've done is we've actually added this Lift Rewards program to further incentivize those people who are already coming and engaging with us. Our rewards program allows people to upload receipts, submit reviews, and then also complete surveys. And then we just give them points so they can redeem those for merchandise or gift cards. Our platform, really what it does is it brings all of those data sets together in one place so that you have one source of truth. And with that one source of truth, brands, specifically cannabis brands, have one place they can go for all of their consumer insights.
Michelle?
So at Strain Print, we focus on the medical side of cannabis. So we have an app that's free to anyone to download, and a patient will track their journey using medical cannabis to treat specific symptoms. And what the patient will do is they'll enter in what symptoms they're treating, what products they're using, and their their state of discomfort before and after they're medicating on a scale of 1 to 10. So after they're medicating, the app will ask you, how are you feeling now? And that's determined by your method of ingestion. So in the moment of when the onset occurs, you're saying, okay, out of 10 now, how bad is my headache? So in the end, you get a score that quantifies your efficacy. And this is really different from people just saying, it worked well or it didn't work well. You have your data in the moment of how it works. And as the user, the app gathers all your data, so it'll spit it back to you and say, hey, remember, you look it up and say, oh, what worked best for headaches? Oh, it was this many inhalations of this product, this time of day. So the patient really, really benefits from understanding what works, and they can also look at similar cohorts and what they're using. So gathering all of our data, we have 1.4 million of these records, so you can easily see as a 25-year-old male suffering from anxiety what else is working, and that's based on a really robust data set to say these are the top products. And so as the patient, you get helped. On our end, we also gather the chemical profile of the cannabis products that's available. So everyone has to test for THC and CBD, but anyone who has terpenes that have been tested, that we have the data, we have that in our back end. So as the patient, you're able to say, I used sour kush, treating my headache, it was great. You know that, but on our end, there's 5 sour kushes, right? So we know the different chemical profile. So the people who use our data would be like clinics or LPs can understand the chemical profile of what is it, what terpenes is it, what ratios of everything is really what's driving the efficacy.
That's great. So, and Alex, of course, you're a bit different in all of this, being with the Ontario Cannabis Store. So, and you come from a public service background. I'd like to hear how you're integrating and how you're collecting.
Great, thank you. So most of the audience is probably aware OCS is the only e-commerce platform for recreational cannabis in Ontario, and we are the wholesaler to private retailers in Ontario. So the majority of our data is transactional, sales-based information, and so how we generate our data is through transactions, and we process that data, aggregate that data, and the primary users of our data right now are our suppliers, our LPs and accessory suppliers who are interested in the sales rates and the velocity of products that move through our supply chain, as well as the attributes of those products that have higher sales velocity. So what is the consumer demand in Ontario, and what are the attributes of products that are selling well in Ontario? So the primary clients right now are our suppliers. We provide them with the sales rates of their products and also inventory levels so they can know when they have to supply the Ontario market with more product. Thank you.
Thanks. So how do you find that the companies use the data? How are they taking the numbers that you have and creating their corporate objectives, telling their story, using it to bolster their bottom lines? And I mean, I know that that's an internal process for you, but I think if anyone's ever worked in a large organization, you know you have internal clients as well. So maybe we can actually start with Alex on this one and go
Sure.
the other way.
Sure, thank you. So how we're using that data is typically also how LPs are using that data. So they're looking again at the attributes of those products. So predictive modeling, machine learning models to look at which attributes of products are selling faster. And then using that information to then grow the product that ultimately will do better in the Ontario market. So we're using the data to enable supply decisions and enable more product for the Ontario market that's going to sell well and at a price point that makes sense.
So there are any products in particular that are selling hotter than others?
Yes, in the recreational market, it's obviously high THC, low price per gram, and those smaller pack sizes, 1 gram and 3.5 gram, for example.
That's cool. I like knowing these things. And for you, Sean, Lyft.
Yeah. So our data really goes beyond sort of the transactional data because looking at traditional CPG markets, it really is up to that producer, that brand, to bring the data forward to the retailer to say, this is why my product should be top shelf. This is why you should have my product over here and not over there. And if you're only looking at the sales numbers, you're really only looking at what's selling quickest, not necessarily what's most profitable for your business. And you might actually be losing a certain customer base just by looking at the sales numbers. So the other thing that we do, we make sure that all of the data that we collect has a really clear value exchange. So the consumer is coming to us and we're saying, great, thanks for joining Lyft. Provide us your profile. They do that, we give them some points. We say, great, now how about give us a receipt? And they say, sure. We give them some points. And we do this with all of our motivations, so it's really clear what that value exchange is, and they understand that their data is being used to help the industry. With all of these data points that we're bringing in, we're able to look at what the consumer purchase behavior is, but also tying that to how do they feel about the product, how are they using the product, how does it impact the brand, how does the brand impact their purchase. So we're really looking across the entire spectrum of the brand as it relates to the consumer.
So Michelle, I know you touched on this a bit earlier, but can you maybe expand on, especially on the medical side, how this is?
Right. So cannabis as a medicine is not studied very well, and there's a lot of reasons for that. About a year ago, people were all waiting for, or even more, people were waiting for clinical trials to be able to understand the efficacy and understand what cannabis works for what. But due to all the people who want to do trials, and Health Canada is trying to figure out how to do trials, the focus has shifted away from that because people are pretty much saying, okay, that's going to take a while. We need to figure this out now. So at Strainprint, with all of our records, it's the largest observational data set that exists right now. So we're using that to be able to educate people in the industry, whether it's formulation, understanding what components work, whether it's looking at, for the LPs, what strategic initiatives they should do, or competitive intelligence, and also for the medical community. Number one is what should they be recommending or understanding, and it's not just an easy, simple, this works for this. What we have learned is that there's a number of factors that influence efficacy, whether it's age, gender, method of ingestion, time of day, dose. So many things are going to affect efficacy, and by being able to take all of our data and share the knowledge that we have, that all of these things are factors, we're trying to educate everyone out there to say, it isn't just a prescription of, this THC to CBD ratio works for something. Terpenes are super important. The genetics are not necessarily as important for certain indications. So we are uncovering all these things because it doesn't exist.
So what about the app? Okay. When I think of data, I think of really cool tools, right? Does anyone here read the Globe and Mail, maybe online, on a regular basis? Do you ever see their great data visualization tools that they have, where they're taking crime stats, or it can be various financial tools? I was wondering, have you been able to apply these in any way, internally or externally? What's been the coolest application of your numbers, of what you've collected to date? Yeah, this was not on the list. Sorry, I'm throwing them a curveball. So yeah. Anything?
I can say from a data access perspective, we enable our suppliers access to their data through a web portal, and it's an interactive web portal, and we feel it's pretty innovative, and they can use it for visualizations as well. So it's one way that we're using an application to enable analysis and visualization directly for the user.
Sean, you seem to be nodding along. Or you just want him to talk?
No. Yeah, I'm really enjoying the conversation. For me, I mean, it's honestly being able to bring those measures that everyone is used to in the CPG industry. A lot of people that we talk to are coming from companies like Coke, and they're coming into these big LPs going, where is my data? Right. And that's the question. And so they're spending a lot of money on surveys and focus groups, and they're going out and buying POS data, but it's all sort of disparate. And so for me, it's really just walking in there and having them say, oh, okay, great. We can look at repeat customer count. We can look at our sales projections, those typical measures that they're used to. So it's nothing fancy like a machine learning model that I'm most excited about right now.
Right.
It's really just bringing what they're used to into an industry that's growing.
Michelle?
And for us, the application we're most proud of at this moment it's a timely question, is we've put all of our analysis and insights together in a report that's where we've just launched this week. So as just what I said before is this information doesn't really exist about efficacy and what's driving it. So we've really thrilled to be able to take all of our data and share it.
So how will your data, either enhanced or augmented, meet the needs of consumers in the future? Anyone? Anyone? You can just jump in. We're friends at this point,
Yeah, sure.
you know? Like, if
So-
we had, I wish there was a coffee table, I'm not gonna lie, and maybe some tea. And I would have liked those chocolate chip cookies, I'm not gonna lie.
I've been on a few panels, and the chairs are always uncomfortable. That's the other part.
Yeah,
Maybe
I think
loungers.
these ones okay.
Yeah. We're in a unique position where the data that we collect, consumers, yeah, they share it with us because they want points, they want to redeem for rewards, but they also want to help other consumers. And so if we're taking the consumer perspective, people leave reviews because they went out trying to look for cannabis products and realized they couldn't get any information on cannabis products. So then they say, well, I'm going to give a little bit back because I tried this product and it did this for me, I tried it here, this is what I thought about it. When we're looking at things like receipts, it's the same thing. We can start to look at buying behavior, we can look at average price, we can start to take that information and provide it back to the consumers as well. So there's definitely a lot of opportunity to continue to provide back in a way that helps inform the community.
Michelle?
I think that in the future, our data is going to help augment the industry in a way where the transparency of chemical profile is going to become more important. And at this time, we're still in a new industry, and your only mandatory testing is THC and CBD, but the more research that we have or that's just out there is the importance of all the other cannabinoids, terpenes, flavonoids, and the real importance of when you find a product that is working for you based on your endocannabinoid system, you need to understand what that is so that you don't go to another LP and buy something with the same name, you think it's the same thing where it's not. So the more consumers are demanding transparency of the chemical profile, which is what we're seeing these days, it's going to help augment our data set where, when the labs are going to test for everything, which is going to inform our data, we're going to be able to have just a lot more data to be able to understand what's working and help patients.
Great. And from a merchandising perspective and economics and social policy perspective, I'm hoping that the data that we're enabling for the industry is going to be fueling research into price elasticity and using that data from a demographic perspective to know exactly what those price points are so that we can balance our mandate for a socially responsible marketplace, but also battle and take market share from the illicit market, right? So from an economics perspective, I'd like to see more research into the pricing domain and using that data in that regard.
So in your individual realms, what are some insights that you've garnered that surprised you? And maybe you can also share one that you think was like, everyone was right, you're dead on. This is, typical of the medical consumer. I'm just curious. Michelle?
Some things that surprised us looking at our data is that the efficacy of each symptom isn't necessarily related to how often it's used. So you have cannabis being used for symptoms or indications that are it doesn't work as well as for symptoms that are treated less. And I think that this is really important because I think people who are choosing to use cannabis as a medicine think of certain things that it may be good for, where there's other lesser used, or it's used less for other symptoms where it's much higher efficacy. So I think that's a really important thing. It doesn't mean that if lots of people use it for this, it works best for this. Another, I guess, funny little thing is we noticed, even though edibles are not legal, it's like older ladies who are using it, which, I kind of knew that because someone, like my husband's great aunt, who's like 90, has an edible every night before she goes to bed, but the data confirmed that there's other people doing the same thing. And some things that we did expect is that there isn't really a change in behavior pre and post legalization. And remember, we're medical, so a patient is a patient. They're not going to change behavior suddenly when legalization is. The same symptoms are being treated same kind of products are being used. There's been a bit of a shift in behavior from smoking to vaping, which is great. And I guess if you thought about it in advance, you'd probably think that would happen, but it did. So I think when it comes to our expected insights, that was confirmed. And I don't know, we keep, honestly, like every day we uncover something cool. So.
No, I was really interested in last year's report about the green to silver.
Yeah.
Yeah, that was kind of neat about older people and adaptation. I was saying to Jay that I met a woman at the Grow Up who told me about late 60s, likes to sprinkle cannabis on her bacon. You know, like definitely off the prescription, definitely not what you should be doing. But yeah. Sorry, Sean.
Yeah. Beyond the typical insights that we get, there are a lot of people surprised by those standard insights that you see anytime there's the emergence of a new category or, new category segments are added in, like when pre-rolls suddenly started taking off a few months ago. Some people are surprised by that, but I think a lot of the CPG veterans are kind of like, yeah, that was going to happen. When you get beyond those vanity metrics, I think that's where the most interesting stuff comes up. And we've started to see this emergence of a more female-heavy, younger female who's more interested in the health benefits of cannabis. And we didn't really see that early on, but we're starting to see this new group of people going out, buying cannabis. A lot of times they're getting other people to buy cannabis for them from the retail stores. It's their partner, their male partner in a lot of cases. But when we start to dig into those details, that's where it becomes really, really interesting.
It's actually something that we hear anecdotally, of course. We're hearing that it isn't always the young male consumer, but maybe they are facilitating the purchase for someone who isn't the typical consumer. Alex?
Thank you. And I agree with Sean. Like something that didn't surprise me and our team was the prominence of dried flower, right? 75 to 80% of the market out of the gate. So that wasn't very surprising, and we nailed our market forecast. So that was very good. But something that has surprised our team from an analysis perspective is in the early days, consumers are typically brand agnostic. They are preferring the product attributes over the actual brand at this point in time. And in my opinion, it's a short-term phenomenon and dictated by the dynamics of supply right now. But for the most part, consumers are picking products that have the product attributes that they're looking for and not necessarily the branding.
So less about the brand itself. That's really interesting to me. Well, especially because that's what I do. We have to start pushing the attributes. So who is your typical consumer? Who is the typical consumer now? Is it exactly who we're supposed to think it is?
On a medical side, it's the middle-aged. Middle-aged person, equally men and women.
Do you track gender fluidity within there or race? Or I'm just curious.
Sorry?
Gender within your...
Oh yeah, we look at age and gender, region, some different demographic variables. But overall, the consumer who is tracking on the app, I mean, it's obviously likely that it's not going to be the very old consumer because they may not have a phone, but it's the middle-aged consumer. Women actually are a little bit more engaged in their tracking.
So me, yeah.
And me.
Yeah. That's okay. Sean, anything on the consumer side?
I'm really excited about the legalization sort of 2.0 phase of this industry because most of us at this point know who the standard consumer is for our brands. But as soon as these new products come into market, I'm excited for the same reasons most people are. But also because we have a platform where we'll actually start to see these impacts immediately. So as soon as people start to buy these products, we're going to start to see who's buying them, what do they think about them, how is that impacting the brand, what brands are they gravitating towards. And so for me, we just released a white paper with EY talking about this new group of consumers who will never smoke a dried flower, ever. But are saying, absolutely, I would try a gummy. Absolutely, I'll try a topical. And we're estimating it's another 3 million people in Canada that we have no idea what they look like. So I'm really excited to see what happens there.
I'm really excited too. Because one of the things that I'm new to the cannabis industry, not to PR, so one of the things that I've noticed is just it always seems to come back to the same sort of white, younger male consumer when we know that there are people who aren't white, who aren't male or female even, who identify as gender fluid or trans. And, you know, I think that there's a lot more information that we can be mining. And for me, that helps me target the stories to talk to them about the products and educate them. Alex?
Well, unfortunately, our data sets aren't oriented around the consumer, so we can't definitively say,
Don't you watch the cameras? Do you get to watch the cameras?
Sorry?
The cameras going in and out of the stores.
Oh, I see. No, that's not allowed. But the research that we're doing is basically, in the legal channel, it's an older crowd compared to the illicit market. So we are doing external research to try to determine where we're losing market share to the black market, but it's not necessarily a key component of our data set.
Well, I'd like to thank you all for today and for coming and sharing some insights. Alex, I'd like you to know that you spurred onto that. I think we can do a cannabis store clerks movie. So if anyone has an into Kevin Smith, I mean, we both do Weight Watchers, but that's about all. I don't really feel like I know him. That would be great. I have a script idea for him. But other than that, Michelle and Sean and Alex, thank you so much for your time.
Thank you.
Thank you.